Good afternoon. Good afternoon, everyone. Welcome. Thank you for joining us. I think we're just getting started here, and Jacob is setting up our Facebook Live, which is excellent. So nice to see so many of our friends here. All right. We're just going to give it a moment or two so some others can join us if you'd like. Welcome, everyone. It is Thursday, May 2nd already, if you can believe it. And we're so happy to have you here for our event, our brown bag discussion series, May event today. Thank you for that, Jacob. Welcome. My name is Erin Callahan. I'm the Chief Operating Officer of the Diabetes Patient Advocacy Coalition and also of our sister organization, the Diabetes Leadership Council. And it looks like we're just getting set up on Facebook Live here. So for those of us on Zoom, thanks for your patience.
Go right ahead, Erin.
We're all set.
Mm-hmm.
Thank you. All right. Well, hi everyone. Like I said, welcome. Those sentiments certainly carry through. I meant it the first time I said it, and I mean it now as well. Thanks for bearing with us as we're getting started this morning. Happy May 2nd to everybody. May the 2nd be with you. My Star Wars and Disney loving family can't wait for Saturday, and I hope you're enjoying these first early signs of spring wherever you may be. I know in some parts of the country you're really into the deeper parts of summer, as it seems. Particularly for one of our panelists today out in New Jersey. Welcome, everyone. This is our Diabetes Patient Advocacy Coalition Brown Bag Discussion Series. This month, we're celebrating Women's Health and AAPI Celebration Month. That is our Heritage Month. And today we're going to be talking about women's health, diabetes in women, gestational diabetes, and more. I can't wait to see what the and more is, but I have a couple of ideas of what's ahead. I want to thank you all for joining us once again. We are the Diabetes Patient Advocacy Coalition. We're a 501c4 organization, which means that we do have the ability to lobby Congress and at the state level and at the federal level. That also means that we rely on you, our advocates, to be able to join us in the state houses, to write letters, sign petitions, and meet with your legislators, your elected lawmakers, to ensure that they're passing policy and laws that are patient-centered, particularly around the diabetes community. That's why we're here. How we do it, we train people here, just like you, on how to be advocates for yourselves and for your families through DPAC. Advocacy means a lot of different things to a lot of different people. We take a policy focus with it. Of course, that means that you have to be a personal advocate. You have to stand up for yourself. I always say that I started advocating when I was very young and somebody made fun of me in grade school, and advocacy looks different to everybody. But I'm fortunate enough to be able to do what I love as my career, and we get to advocate at a lot of different levels. Our mission is to ensure quality of and access to care, medications, and devices for patients living with diabetes, and to educate, inspire, and empower advocates as well as lawmakers toward meaningful action on diabetes. And that is a lot of syllables to say, like, we want change and we deserve it. And we know that everybody in this community and our caregivers work so very hard to ensure that we achieve our best health outcomes and our best quality of life. I was just talking with our esteemed panelists before we started about some of the changes that have happened over the years. As a matter of personal introduction, I've been living with type 1 diabetes for 37 years, so I've seen a lot of changes. And I love welcoming folks just like Alejandra, and especially Alyce, to our talk today. Alejandra is the head of brand ambassador and specialty pods at Diabetes Sisters. Absolutely delightful. I'll let her share a little bit of her personal story with you as well. Alyce Thomas has a whole alphabet soup of letters after her name, and we love the fact that she is one of our DLC board members, thanks to her leadership roles in other diabetes-focused organizations. I am going to read off your official bios, Alyce and Alejandra, starting with Alejandra. She's been a proud member of Diabetes Sisters since 2013, where she serves as the brand ambassador and Hispanic initiative lead at Diabetes Sisters. She's a project manager professional, a gal after my own heart, and has lived with type 1 diabetes since age 12. She's also active on Instagram, providing a support system, engaging with community, sharing her own experiences with diabetes, as well as parenting a son who lives with autism. Alejandra, you are a patient, a caregiver, and an absolute pleasure. A true icon in our community. Thank you so much for being here with us today. And Alyce Thomas, again, DLC board member, and just gal extraordinaire, if I do say so myself. She's a nutrition consultant for the Department of Obstetrics and Gynecology at St. Joseph's University Medical Center in Paterson, New Jersey. As an active member of the Academy of Nutrition and Dietetics, she's chaired 2 dietetic practice groups, diabetes and women's health, chaired the Evidence-Based Practice Committee, and was a professional issues delegate in the House of Delegates. She's a known specialist in diabetes, nutrition, and pregnancy, and a current board member of the Diabetes Leadership Council, which is, of course, the sister organization to DPAC. And she is a tremendous friend to so many people that I know. Fortunate enough to call her a friend of mine as well. Alejandra and Alyce, welcome to the Brown Bag.
Hola, thank you so much.
Thank you. We're going to jump right in because we have a whole lot to talk about.
Yes.
And of course, this discussion cannot be limited to 30 minutes today. We want to make sure that everybody is following the discussion. Certainly follow DPAC on social media. We have lots to share. And there are a lot of important things that you can do to make sure that we're advocating for women's rights around particularly just diabetes, and certainly looking to some of the gestational qualities that come in if you've been living with diabetes as you're approaching pregnancy, or if you are diagnosed with a gestational diabetes pregnancy diagnosis while you are in. Alyce can tell us a little bit more about the science of that. But I want to get started with the intro, right? Could each of you tell me a little bit more about your experience with diabetes and women's health and what drives your passion in the intersection of these topics? And Alejandra, I am going to start with you alphabetically. That was a close competition between ALE and ALY.
I know.
Yes. We are the A team.
Yeah. Oh,
I like that.
I love it.
Well, I can start when I was diagnosed when I was 12 years old. And I remember clarity when my doctor told me, Alejandra, diabetes is not going to kill you, but you have to manage your diabetes because it's in your power. I always remember that, like, okay, this condition is not going to kill me. I can manage. And he told me you have to, eat well, exercise, and take your medication. And that is what my mind said. I always, eating, do exercise, my medication. I was so managing and organized and planning until I get pregnant and with my son, and he was diagnosed with autism when he was 18 months. And I think like everything changed for me because I was thinking, okay, I started, doing exercise to that grief, to have to receive that diagnosis, that emotion. But in that moment, I realized I have to take care about my emotion and my mental health because I didn't have in that moment, diabetes for me was, I get it, and was in the beginning was hard, but then I got to use. But with the autism, okay, I have to take care about my emotion and my mental health, plus do exercise, eating, and take my medication. And I think my son was the person who opened my mind about this kind of area I didn't have before. And I think he complement my propose, we have to take care if in that 3 things, exercise physically, your body, mental, emotional, and take care of what you're around, all that kind of thing. I think since that, I've been advocate for diabetes since I moved to the United States because I didn't know how to speak English good as I do right now. And I was advocate to know how to get to doctor, the supplies, all that kind of thing, and that helping me to be more advocate for diabetes. And now I cannot stop about diabetes. I always, talk about diabetes all the time, and that is my life with diabetes. And I'm so happy I can help and share with you in this panel. This invitation for me is, this is a open window for everybody, for me and for the people who are listening us.
Thank you, Alejandra. What a wonderful inspiration that your son is for you and that you are for us. So thank you so much for such dedication to advocacy and dedication to the diabetes community. You are in the right place, my friend.
Exactly.
Thank you for being here. No stranger to commitment to diabetes advocacy. Alyce, please share your journey here and what brought you here.
Well, it's interesting that Alejandra is also not native born to the US. I was born in Canada.
Oh.
And during my internship, which was in Montreal at a place called the Montreal Dye Dispensary, and actually the WIC program that many people have heard about is patterned after the Montreal Dye Dispensary. And we focused on prenatal nutrition. That's what we did for the whole time that I was there. But it wasn't until I came to the US and started working at a large urban center that I noticed that women who had type 1 and type 2 diabetes had poor outcomes. And that kind of started my journey and my passion for working with these women, because all of the things that you hear about with women and diabetes, I've seen it over the years. Babies who had fetal anomalies, macrosomia. We had patients who babies weighed like 11 and 12 pounds at birth. Babies that were born with low blood sugars, more miscarriages and stillborns. So those are the things that I was seeing. And way back then in the early 80s, we didn't even have self-blood glucose monitoring at all. So the patient went to her doctors once a week, once every 2 weeks, and her blood was drawn back then. So she didn't get the results right then and there. So again, I've seen how diabetes has progressed over the years. And I'm very happy about it. One thing that I'm not happy about is that it takes longer for pregnant women to get the same types of care and treatment than non-pregnant people with diabetes, because a lot of researchers don't want to work with pregnant women. But yeah, I've seen that when self-blood glucose monitors came out, that it was like once a day, and still you have insurance companies, and you may get into that a little bit later, that will only allow women to have one blood glucose monitoring done a day. What does that tell us? Absolutely nothing. So my passion is that at the end of the pregnancy, that we have a healthy mother and a healthy baby. You can't put a price tag on that.
That's good. I love it.
Put that on a pillow, Alyce. You're absolutely right. And I think, Alejandra, you mentioned some concerns that you initially had about pregnancy, particularly around your diagnosis and as you were growing up. And we know that especially young women are facing some of those same challenges, right? And of course, it's born of some of the history that Alyce shared, where the outcomes were not great and things did not look very positive. It was a very threatening environment. In your experience, can you share just quell some of the concerns maybe, or tell us about your experience with pregnancy as a person with diabetes?
Yes, I remember when we started thinking to get pregnant, the doctor told us the first things they told us is what your A1C have to be 6 or less. You have to prepare, like 3 months or 6 months before to start thinking and to start trying, Right. And I was like a freaking out, I started doing my more restricted, all that kind of thing. And when they allow us, when I got my A1C 6, they say, okay, you can start her. We got pregnant, and my pregnancy was so good because I found Diabetes Sister, this group, the woman with diabetes, before, and I was, I started with a glucose monitor before. I didn't know, but most of these ladies have it. And I was, okay, I need this kind of thing. If I want to get pregnant, I want the insulin pump, because I didn't have in my country in Venezuela to get all that devices was so difficult and expensive. And was when I moved here in the United States and found this group, everybody have insulin pump, everybody have, sensor. I was like, what is that? And I started, take care more and have receiving all that tips from this lady who are mother, who have 2, 3 children. And then in one of the conference, I met one guy, Gary Snyder, who is the author of Think Like a Pancreas. That book I recommend to everybody who have diabetes, have to read that book. Because it's true, we are doing the work for the pancreas. You are the pancreas when you have diabetes. And that book explains you everything about Think Like a Pancreas. And then they have a coaching, like a pregnancy coaching. And when I was pregnant with maybe 5 months or 6 months, and I registered for their services as a pregnancy coaching lady. And she was Jennifer Smith, and she helping me through all my pregnancy. Well, I have my endocrinology, my OB, both are, my OB was a high-risk doctor, for the pregnancy. They know a lot, but I think you need more like a companion, and also during the every month change your sensitive of insulin when you are pregnant. And having that coaching, it was a relief for me, because also she take care 3 months after you get born, your baby, and she helped it 3 months after. And that was, it was expensive. It's not, the insurance doesn't pay. I wish the insurance paid that kind of thing, because the doctor cannot check out, all that kind of things, but is perfectly. I think that kind of helping when you are pregnant, because you are so insecure, if you are doing correctly, if your sugar is going to affect your baby, all that kind of things, that kind of companion is make a difference. And you have to be proactive. You have to read, you have to listen podcasts, you have to, come to this kind of panel. If you want to get pregnant or you are pregnant, you have to be connected with what is going on, what is the better treatment you can use for you. I think that is the key. Don't be, no active. You have to be proactive.
I think
it's
not easy. And I think that's a tremendous part about living with diabetes. I believe there's a Stanford study published in 2017 saying that people with diabetes make an extra 180 health-related decisions per day. And when I read that, I thought, I didn't think I made 180 regular decisions per day. And now you're adding 180 health-related ones. Wow, that's crazy. But Alejandra, you bring up so many good points about access. And Alyce, your role on the Diabetes Leadership Council is really to help provide thought leadership on policy. And did anything that Alejandra said resonate with you about being able to get that care access, being able to get that tech and tools, being able to get that postpartum care? Tell us all about it.
Okay, well, it starts from the preconception area. And when I talk about preconception, I'm talking about 2 different things. I'm talking about women who are not planning to become pregnant, and then women who are planning to become pregnant. So let's go with the preconception counseling. That's different. Every woman who is of childbearing age, whether she has diabetes or not, should have a reproductive plan. 40% of all pregnancies are unplanned, and it's even higher in women who have diabetes, about 60%. So we're seeing women who are coming in with A1Cs of double digits, 12, 13, 14. And when you think of pregnancy, it's such a short period of time that we have to get her blood sugars into a level that is kind of normal. Sometimes we don't get it to normal. If we can get a woman from 14 to about 8, that's a big
lot of progress.
Yeah. So that's the preconception counseling part of it. The preconception care is that if you have any type of medical problem at all, that should be taken care of before the pregnancy. So if she has problems with her eyesight, we've had women that have gone blind during the pregnancy. We have women who are on dialysis. So all those major medical problems should be looked after before the pregnancy, and then it increases the outcome of having a good outcome, I should say it that way. So those are the things. There are things that we don't even think about. So if you are planning a pregnancy, start taking a prenatal vitamin. You need 400 micrograms of folic acid a day. Some of the medications that they take have to be changed because some of them we used to call it the black box, or the category is an X. Some of those medications should be changed during pregnancy or before the pregnancy. Even some of the diabetes medications need to be changed. So when we talk about policy, what I see is that women who, for me, diabetes and pregnancy is a no-brainer. So whatever the woman needs, she should have. If you look at the 2024 American Diabetes Association standards of care, most of them are in level A. So a woman should be able to monitor her blood glucose levels if she's using a meter. Then it's at least 4 times a day, not once a day. It's only, I think, last year that the FDA approved continuous glucose monitors in pregnancy. So those are the types of things that we're seeing. So for prior authorization, that should not be for pregnancy. Step therapy should not be in pregnancy. And, you know, when you talk about non-medical switching, that again is a no-brainer, that if a woman who has type 1 diabetes and she's achieved really great control, and then all of a sudden the formulary changes and she has to go on another medication, it doesn't always work for everybody. And I've seen the endocrinologist that I work with, that she has had to go to bat for many patients. This particular medication worked for her. She's pregnant. We don't have time for her to get used to another medication, because what is the effect that it's having on that baby and also for her too?
Right. Yeah. And as you mentioned, Alyce, I'm just going to kind of double click that there's such a limited window. The concept of fail first is a little wild to me anyway. Nobody should want anyone else to fail. Certainly it shouldn't be a directive. But there are limited opportunities to fail and then recover successfully, particularly in pregnancy when you're dealing with such a limited amount of time. And that's one of the reasons that the Diabetes Leadership Council and Diabetes Patient Advocacy Coalition take as much action as we do on ensuring affordable, equitable access. And Alejandra, you mentioned that you had limited opportunities in Venezuela for access to some of the things that we have here, including a CGM. But we know that even within our own borders, there are tremendous disparities in access to healthcare. And Alyce, I know that you have professional experience in working with women who may not have the, I can't believe we're calling healthcare a luxury, but the luxury of affordable access. And can you tell us a little bit about what happens and maybe even some advice on what women can do who may not find themselves with that access at their fingertips?
Oh, wow. I don't know if we have enough time.
Sorry.
And I can go back to what we experience in our clinics, because we give the woman a prescription for whether it's insulin or a monitor or something like that, and she's coming back in a week or two and she has nothing because she's gone to her pharmacy and the pharmacy has said, well, your insurance company has not approved this. So what happens is that she has gone 2 weeks. She has elevated blood glucose levels. We don't know what the effect is on that baby. So again, it takes time in order to get that approval. And if you think in terms of women with gestational diabetes, it's only 12 to 16 weeks because it's not diagnosed until 24 to 28 weeks. So every week or so, it's less time that we have to get her blood glucose levels under control. So what you were saying, Erin, about the step therapy and the fail first, we can't do that in pregnancy. So that's where my passion is in advocacy, because we don't have time. And what is the long-term effect? We don't know.
Yes. I agree with you, Alyce, because if we prevent, you know, if we check up everything before get pregnant, and if you are pregnant, okay, what I can do better? I think like or where can I find more resources, or where can I go? You know, asking, never stay, you know,
Right.
you don't have to wait. You have to go and ask.
You know, I'm in a place, I'm so fortunate that we have an interdisciplinary team. So we have a social worker who can work with that. But I think of
That's
all the women who don't know the
exactly.
services that they can go to.
Yeah.
Yes. That I think that is the most difficult because, and some people also the language barrier, you know, when you don't speak
Mhm.
is when I moved here, I was thinking I speak English, but when I moved here, I couldn't understand. But I did a research, you know, Google, and I find in that time was a blog for diabetes. And in that blog is how I found where can I go if I don't have insurance, because we were students and our insurance didn't cover diabetes.
Mm.
And they explained me, someone in the community, like I can go with the community health, you know, in my city, and they have like a retired doctors, you know, the companies gave the supply of insulin, all the basic. And that is when I went to that community health and they registered me as a student, and they gave me all the supplies for diabetes for 1 year. I didn't have insurance. And I was so relieved because I was, okay, how can I do? I bring all my supply from Venezuela, you know, for 6 months to see how it is. And that is what I told you, because I was proactive asking, you know, to the community. I don't know. And one of my friends go with me to do like a translation a little bit, I
Mhm.
remember, but it was a relief, you know, to ask and find that information, you know, asking. And they helping me for 1 year, and then I helping them volunteer doing like a training for Spanish people, like a diabetes, you know, carbohydrate, all that kind of thing, because I was so relieved. You know, they helped me for 1 year without insurance.
That's
That's
incredible.
that's wonderful. But
Yeah.
unfortunately, many of the patients that we see don't have that type of service available to them. So we're kind of struggling, especially with the language barriers and all, because
Yes,
I'm in New Jersey. So we have so many different languages, and
exactly.
trying to get those types of services in such a short period of time. And I think
Exactly.
that's the real thing, the real problem in diabetes and pregnancy is that
Yeah,
you don't have a year
exactly.
to get everything together. You have a short period of time. So what can we do to get the services that this woman needs, the services, the supplies, the equipment, everything that she needs, so that it increases her chance of having a good outcome? Because to
Yeah,
me, every day that she's delayed in getting the treatment that she needs, we have no idea the effect that it's having, not only on that baby, but her health too.
exactly. Well, it's like my son, because my son he has autism, and I read some of the, well, I control my diabetes. You know, there are many issues, but maybe my sugar, my, I don't know, some of my range, what was one of the input. He developed autism, and it's a research, like some diabetes people, a woman can have is more probability to have developmental delays, you know, all that mental health. And it's not my fault, but I think like if you take care before, and what you say, you have that resort on time, we can reduce that possibility, you know,
Right.
and have, I think like is good.
Well, and we're so grateful that you were able to support others, Alejandra and Alice, in your professional career, that you've really taken up and championing the efforts on behalf of women with diabetes. And I want to just touch on, I realize we are at time that we could go on for days.
Oh, okay.
Um, One thing I do want to touch on, we've talked a lot about, coming into a pregnancy with diabetes, but I'd like to shift just a little bit to developing gestational diabetes and a diagnosis while you are pregnant. And we know that there is a higher propensity to develop a type 2 diagnosis after pregnancy. But Alyce, can you talk to us a little bit about people who have had gestational diabetes, anything that they should do and what steps that they can take just to ensure their post-pregnancy and postpartum health?
First thing they need to do is follow the advice of their doctors.
Always good advice.
Because 50% of women who develop gestational diabetes within 10 years will develop type 2 diabetes. And in certain ethnic groups, it's even higher. It's about 70%. So how many women actually come back for postpartum care? And it's only about 50%. We wish it was 100%, but it's only 50%. So one of the first things that a woman should do who's developed gestational diabetes is to come back for her 2 hours, 75-gram oral glucose tolerance test. What is that test going to do? It's going to let us know that if this was just something that happened during the pregnancy, or maybe she had pre-diabetes, or maybe she had diabetes that was not diagnosed until the pregnancy. Right. So with that particular test, it will let her know what's her risk factor of developing type 2 diabetes later in life, or even within 5 to 10 years. So that's very important. The other thing is postpartum depression. A lot of people don't even talk about that. I'm happy to say that in New Jersey, we do have a program where every woman, after she has her baby, she comes in for postpartum screening. And we've had women who tested very high, and they had to be taken to the emergency room because she could have either harmed her baby or herself. That's very important too, and something that we cannot forget. The other thing is that after she's had the baby, whatever, the diabetes prevention program says that if a woman is taking metformin and lifestyle intervention, it can either prevent or even delay the progression to type 2 diabetes. So all these things are important. So it's not like, I know I got pregnant, I had the baby, and that's it. No, get pregnant, have the baby, and take care of yourself.
Exactly.
That might feel very, very difficult to do when you're also trying to raise an infant.
A baby.
Of course it is.
The whole person. And I want to take this time to thank everybody for joining us, and to say that we have talked about a lot of the challenges around diabetes and pregnancy, and a lot of the things that you want to look out for. Alejandra said it best, that you really just need to learn and take on learning for yourself and understand and kind of break down those walls as to what you need to know. Alyce said it best, like, talk to your doctor, follow their advice, and get the care that you need. I can also share with many of you that I know for a fact that there are a couple of folks that are watching this, that are with us today, that have had very successful pregnancies. Alejandra, you are no exception to that. We've got a couple of other friends in the audience who we've even featured your stories when we're talking to state legislators, to say, if we can ensure the health of the mother, we have a really good chance at assuring the health outcomes of that baby. And we want to make sure that everyone knows that there are resources available. Alejandra, is there something that you can share from Diabetes Sisters where anyone might be interested can go?
In Diabetes Sister, we have meet up online, virtual, the first 2 weeks of the month, and the last 2 weeks of the month, we have webinar and workshop where we talk different topics. And to go to this kind of meetup, for example, is, as you as I tell you my experience, it was when I learned about the insulin pump at the CGM. And if I have all of that kind of thing that helping me to get pregnant and manage my pregnancy better, and now my life, I love my CGM and my insulin pump. It's part of my that kind of group, that kind of trip you know, the people, the woman like you is a good resource you have to have. And also you have to look for a healthcare like Alyce. If I was in New Jersey, I will go with her. Of course.
Thank you.
That is so important to have that kind of empathic healthcare team.
For sure. Alyce, anything that you can share with us in terms of resources or final words to our folks today?
Okay. Well, the importance of, for me, preconception counseling.
Yeah.
Okay. Everything begins before the pregnancy. And if we can get women into optimal health before the pregnancy, I'm seeing much better outcomes now than almost 50 years ago when I first started in this journey. So even though I might have talked about, the things that can happen, I'm telling you, when I get back to a healthy mother and healthy baby, it's priceless. And we have those things, I have so many pictures of women who have sent pictures of their babies to me. I have babies that's named after me.
Of course you do.
Spell their names with a Y too. So even better.
Incredible.
So that would be my advice. Start before the pregnancy and then continue it even after the pregnancy so that it's a continuum.
Thank you. And I want to kind of put a bow on some of the things that we mentioned too, that mental health care is really, really important.
Yes.
May is also Mental Health Awareness Month. And there is no question that all of these things are inextricably linked, and to ensure that you have the right care provider, the right care providers, also a system. But one thing that's also rung true on this call is the importance of community. And Alejandra, you really lead that with Diabetes Sisters and your role there. You've experienced it, which is so wonderful to hear. Alyce, as a member of the DLC and DPAC community, you absolutely do the same. And we're honored every time that we're in a space with you. So thanks to both of you for joining us. And to those of you who have joined us for this call, we hope that you've loved it as much as I did. I can't believe the time flew so fast. Jacob has put up a QR code. If you are not one of our advocates just yet, click on that and join us. We will tell you how to get involved. We will tell you how to advocate for yourself. We will give you all the tools that you need to ensure that we are talking to legislators, policymakers, decision makers, quite frankly, on how to improve the lives of people impacted by diabetes. That's why we're here. That's what we do. Thank you for joining us, and we hope to see you on our next Brown Bag.
Thank you so much, Erin. I
so
really
much.
appreciate it. Yes, this conversation was so good.
Awesome. I agree. Y'all are the best. Thanks, everybody.